Hey Dave, have you happened to hear any information from the doctors that Mookie has seen, or even from him, just kind of how that went?
I know that he's in LA and he got some type of injection to help the pain subside, which it has. Um, Still, obviously, not doing anything as far as activity. Um, when it's time to play, return, I still don't know, but I do know that the pain has subsided.
And for Justin, is the timeline still for him to potentially be in the lineup tomorrow or even at some point this weekend?
Well, the hope is this weekend you can do more, catch some grounders, move around a little bit, take batting practice. So we'll certainly have a better idea tomorrow. But I just don't want to push him and make sure the training staff and Justin, most importantly, feel confident. So can't answer that. But I still hope is, he'll be in the lineup this weekend. But if it, in some capacity.
And I know at some point earlier this week you had mentioned potentially bringing Zach McKinstry. Is that still a plan? And if so, when do you think that could play itself
Well,
out?
Zach's here taxing, and I think that where we're at with pitching, I don't see an activation tonight, and we'll just have to address it tomorrow. Obviously, he's the versatility piece is paramount, but I think right now with the pen, the shape of the pen, and the length or lack thereof that we have with guys, I think it's just the extra arm is important.
And with the Mets, obviously, you guys are facing them this weekend. You'll see them again next weekend back home in Los Angeles. What are the challenges and the benefits of seeing a team so many times in such a quick turnaround?
I think it's more like you just said, it's familiarity. It is a quick turnaround. I would say in a vacuum, it probably helps the hitters more than the pitchers to see arms, with more frequency. But it's a team that is coming off a big series. They're playing for something, a division championship. So you got two teams that are playing for something. So it's going to be a fun series.
Thank you, Dave.
Yeah.
Next question's for Bill Plunkett. Go ahead, Bill.
And Dave, with Mookie, did you get any more clarity on what's causing this and why it can't go or won't go away?
Well, it's a bone spur that is sort of tied into the hips, and it's like really internal. So we don't know kind of the how it came to be. So it's a bone spur. I really don't know the exact location. All I know is that it causes enough discomfort for them to not be out there and to go on the IL and to get an injection for the pain to dissipate. So that's kind of all I know, Bill.
The injection sounds like a short-term solution. Is this, bone spurs usually lead to surgery, don't they?
Well, it is a short-term solution. And I think that right now where we're at, we're trying to figure out what's the best way to get him back with us and through the season. Then kind of once we get to the off season, we'll kind of address that.
Thank you, Dave.
Yep.
Next question's for Mike DiGiovanna. Go ahead.
I think Punk stole my thunder again there, Bill. Dave. This condition usually requires surgery. What did they say, the doctors say about, how to tolerate over the last couple months of the season?
They said what? Mike, you cut out real quick.
I'm just wondering if this condition usually requires surgery at some point. What did the doctors say in terms of what he can tolerate, playing?
Yeah, I think that's more individual based, and where he was at, it was too much to tolerate. So hopefully, with the injection, hopefully, I know right now he's not active. From talking to the training staff, pain has subsided. So when he can return, I still don't know because he's still got to get ramped up and see how it feels. But outside of that, I just really have no educated comment.
Okay, thanks.
Yeah.
Next question's from Fabian Ardaya. Go ahead.
Hey Dave, with this, when you guys can get him back onto the field, is this just going to be where Mookie's at, like that from the rest of this point of the season, or is it still a consideration where like you have to keep managing it day to day?
My assumption is we're going to keep managing it day to day, but hopefully this shot has a longer lasting effect. But we don't know until we look out 7, 10 days, a month from now, and once he starts ramping up more with the physical activity.
And then with Julio, I know we've asked you a bunch about sort of his innings totals. Now that we're at this point, how have you sort of seen him handle that workload and where he's at in relative to the rest of the year?
Julio's handled it with flying colors. He's been fantastic. He's having a tremendous season. We're certainly aware of where he's at with his innings. There's just each outing, looking at where we're at, giving us the best chance to win, leaning on Julio versus taking the gas off to pass the baton for that night. Will there be a time where we give him a blow, a respite? Possibly. Because I think that the most important thing is to keep him healthy and to keep him fresh through October. So that's something that we're constantly having those conversations.
Thanks, Dave.
Yeah.
Thanks, Dave. Thanks, everybody.